know that you spend part of your time in the educational system and have a strong interest in training new individuals to work in this field. What should our graduate and medical pharmacy nursing schools teach more of to enable researchers and clinicians to be better managers of these real-world data insights?
Well, I'm so glad you asked that because I think that it would help to learn about real world evidence and, of course, specifically epidemiology, because I think teaches you critical thinking. Right now, our most physicians have learned in medical school about randomized clinical trials, and they view that as the gold standard with some good reason, no argument. But they like simple scales. Here's a grade of evidence. This is on the top, this isn't, so that what isn't must be bad. They need to understand the value of what they can learn from natural experiments, from natural history studies, and where they should be questioning those and what they should be wondering. So, now everyone says, well, it's not representative. And that it just grates at me because I don't want everything to be representative of everybody. I want to know about specific characteristics. I want to build the evidence base so that I can tell you about here's how new immigrants from the Asian countries react to such and such a product. Here's how different ethnicities, different age, different gender react or benefit or don't. I want all those points. I don't want them mushed into one average treatment effect. I
Mhm.
want those
Mhm.
specific treatment effects for the different parts of the population that we're interested in. And you need to train people to understand why, if you can only study a certain community, why that evidence may be valuable in itself.
Mhm. This is a little bit of a tangent, but as you were talking about that, do we underrepresent the nurse's view of being a communicators of the patient's perspective? We often talk about the clinician, meaning typically the medical physician provider. But I'm just wondering, given the extraordinarily important and bedside role of nurses in our healthcare delivery, if we don't delve in enough to what they can offer us on our understanding of disease and treatments and patients.
That's an interesting question. And I think we have to broaden it. It's not just nurses. It's now we have nurse practitioners, we have physician assistants, and
Mhm,
many of them are extremely knowledgeable. And
mhm,
if I could say, more patient than some of the clinicians. You
mhm,
take a busy surgeon, they want to be in the OR doing their thing. You talk to their PA, you can often get very thoughtful answers about the things that are troubling you as a patient, and it goes a long way to increasing confidence, to reducing anxiety, and I think to better outcomes. So I
mhm.
think there is an extremely valuable role for these non-physician caregivers, but I'm not sure I have the system for doing that.